I'm now being joined from our Abuja studio by the Director of Disease Control and Immunization at the National Primary Healthcare Development Agency, Dr. Dorothy Nwodo, to shed light on the controversy, which is the vaccine that was given in the southeast and was refused by most of the residents there. Welcome to the News at 10.
Thank you very much.
Now, first, what do you think is the source of this rumor?
Well, there has been an outreach services being carried out by the Nigerian military yearly, and this was taking place in Anambra State. And they started carrying this campaign of calumny that they were injecting certain vaccines amongst the children, and that was not the case. They were just carrying their social responsibility, taking care of adult population, treating them of different health concerns. And because of this campaign of calumny, the outreach services were stopped. And I'm here to reiterate that there is no association of immunization with monkeypox virus, which is being carried about in the northern part of the country, the 17 states, where we are having the sub-immunization plus days. The parents are refusing their children to take immunization. And I'm urging parents and guardians to bring out their children to take immunization. This is the greatest investment you can make on your children, our future leaders of tomorrow. Immunization is safe. Vaccines are safe. Our vaccines are potent, are free, are effective, and are safe. And they are World Health pre-qualified and NAFDAC approved in Nigeria. And I know that immunization is the greatest asset you can give to your children.
Dr.
It is a barrier between us and...
Don't you think the military not creating this awareness before they started giving out this vaccine gave room for this campaign of calumny, as you described it?
Yeah, they were not giving vaccines. They were treating adult populations. They were not giving vaccines. Before you could give vaccines to children or to anybody, it has to be certified by the National Primary Healthcare Development Agency. And the Ministry of Health in Anambra State have refuted this. They were not giving vaccines. They were just carrying outreach health services to the adult population.
So what steps do you think can be done to address this situation?
Well, we are already doing a lot of social mobilization. We have sent a press release that there is nothing, there is no harm on having immunization, giving immunization to your children. And there is no association between immunization and the rumors that are carrying about monkeypox disease. There is no vaccine for monkeypox at this moment. Monkeypox will clear within few days. We do not have vaccines for monkeypox. Our vaccines are safe, potent, effective, and is the correct bodyguard for any child. And it's a great barrier between you and disease. And the federal government of Nigeria is spending quite a huge sum to make sure that we have vaccine in country at any point in time.
Do you think this will in any way affect your immunization program in the southeast when it begins?
Well, before then, we must have done a lot of social mobilization and communication campaigns. And I don't think it will affect it because I believe they know what is right for their children. And that is why I'm here in the studio to let them know, my brothers and sisters, immunization is the best bodyguard for your children. If you want healthy children, our future leaders of tomorrow, please allow your children to come out and have immunization.
Thank you so much. Dr. Dorothy Nwodo is the Director of Disease Control and Immunization at the National Primary Healthcare Development Agency. She was speaking with us from our Abuja studios. Thank you so much for talking to us. Staying with health matters, the World Health Organization, WHO, has expressed satisfaction over the federal government's emergency responses in the Northeast region, describing the conditions there as one that has transited from emergency to a development phase. The WHO Regional Director for Africa has asked the government to leverage on the progress made so far after her visit to Borno State.
The Honourable Minister of Health, members of the WHO family in Nigeria.
We are, in a way, going to be transitioning from an emergency phase to a rebuilding and transitioning to a development phase in the Northeast. There's been a huge investment in the response to this emergency as well as to the response to outbreaks in that context. And what is needed now is to bring together the partners, the development partners, the donors, the World Bank, the African Development Bank, who are more interested in development and are less involved in the humanitarian response, and ensure that they get engaged now to understand the investment that the government and the other partners have made and prepare themselves to help to transition this to rebuilding the health system in the Northeast. We were, of course, very aware that malaria is the #1 killer of children here, and under the context of this lack of access, we're aware that and observed that the number of cases of malaria, number of deaths from malaria rose alarmingly. And I'm very pleased that the government accepted, and we worked with our colleagues in headquarters to put in place these mass drug administration, or so-called seasonal malaria chemoprophylaxis interventions, to make sure that we provide a full course of treatment to children, whether they were ill with malaria or not, so as to reduce the infection rate and to reduce the number of children who fell ill and are going to die of malaria.
The United Nations Population Fund has reaffirmed its commitment to support the Nigerian government in addressing the Northeast humanitarian crisis. Its country representatives, Dene Keita, outlined some of the ways the agency has worked to help young girls and women in internally displaced persons camp in the Northeast at a forum in Abuja.
We are the lead of the subcluster on gender-based violence, and we give protection jointly with the UN Agency for Refugees to young girls, adolescents, and young women and women in the camps. So we attend the IDPs in the camp, and we make sure that they get the necessary protection we can provide them with. You all know about our work with the Chibok girls recently, but they are not the only ones. So we provide them with safe space to make sure that they can learn what they need to learn, but most, just like the executive director said, to give them enough confidence through counseling, through providing care, so that they can reintegrate the society. So we're lucky to host this week the reference group on family planning. And the Minister of Health really provide a very broad and good understanding of Nigerian issues in the Nigerian context. And for that, we have much more work to do. First, to tackle the population issues, the quantity of young people. And for that, we have the operational programs and the policy aspect of that program as well. And plus, apart from the policy, we also have the data. You know, for whatever we do, data are absolutely important.
One of the things that can enhance the beauty of any city, especially at night, is street lights. Nigeria's capital city, Abuja, once proved this, but it appears that's not the case anymore. While some residents and government officials responsible for the maintenance of the infrastructure trade blames, others attribute the recent rise in crime within the Abuja city centre to poor illumination at night.
Abuja, Nigeria's capital, is no doubt a model city with a sparkling beauty at night that reflects the seat of power. Driving through the city's center at night can be a delight, especially for first-time visitors. The situation is, however, changing drastically as majority of the street's lights no longer function, a situation that many residents have criticized.
Go to Kaduna. The major roads are all illuminated. Small streets are illuminated. Neighborhoods. But in the federal capital, Abuja, instead of illuminating more, putting more street lights where they don't exist now, the ones that have been there, you can't maintain them. It's a sad situation.
A lot of infrastructure, apart from the street light, a lot of infrastructures are decayed. Not even decaying, they are decayed in FCT. Both water, both the water pipes, both electricity, both transformers, a lot of them are not being taken care of.
A crime report released by the National Bureau of Statistics in June this year reveals that reported cases of crime rose to over 13,000 between last year and June 2017. An estimated 9,350 of those reported cases are crimes against property, which include pickpocketing, bag snatching and other minor crimes. Some residents are attributing the rise in such criminality to poor illumination of the city centre.
I think it's because of the deplorable state of the street light that lead to a lot of crimes in the FCT today.
There are areas where criminals will use as hideout when it is dark. So if the light is available in the night, you find out that most of the crime will reduce.
However, the government agency in charge of maintenance has accused vandals of sabotaging government's effort to maintain infrastructure in the city.
It's not because the infrastructure is not provided, it is provided. We spend a lot in providing infrastructure. But the major problem is securing these installations. Vandals are always on the highway in the night to steal the underground cable, rendering this the street lights, rendering the street in darkness. So you can imagine the way we are always embarrassed. It's a sort of worry for us, and that the minister is very worried. We spend money, but vandals, some sort of try to render whatever we have done useless.
But residents argue that government agencies responsible for the maintenance of such infrastructure must protect them.
The agency itself should be monitored and know whether if they are doing their job or they are just collecting their maybe, what I call it, impress or maybe allowances and not sitting back in the office.
If the minister of FCT cannot even manage street lights, I can't understand what he will do for Abuja.
Street lights add beauty to many modern cities at night. For Abuja to retain its status as modern city, this infrastructure must not only be provided but also maintained.